Welcome to Apollo Spectra Facebook Live. Today we have Dr. Aditya Shah, consultant medical gastroenterologist, Apollo Spectra, Chennai, with us. Today we're going to discuss about Allurion balloon, a game changer in non-surgical weight loss.
Namaste everyone. I'm Dr. Aditya Shah, consultant medical gastroenterologist at Apollo Spectra Hospitals, Chennai. Today, we are here to discuss with you regarding a new program which we have started. It is basically regarding intragastric balloons, specifically Allurion. Allurion balloon is a specific balloon have, which we can install inside the stomach without any endoscopy, without any surgery. It's a very safe procedure. The only thing which the patient has to do is to swallow a capsule, which is just a size of around 1 centimeter in size. Once the balloon is placed inside, it goes easily and expands after we give the fluid inside. We install a bit of fluid, and then the stomach, it will occupy the whole circumference of the stomach, uh, which will help in decreasing the satiety of, which will help in improving the satiety of the patient. The patient will get full with a very small quantity of food, because of which the patient will not require any excess food to eat, which will further lead to weight loss. Now, who are the patients who require this technique? It is basically for patients who are morbidly obese, who have weight almost more than 28 BMI, for patients who require, who are who have severe comorbidities like diabetes, hypertension, dyslipidemia. These patients will require uh, the balloon. What does the balloon do? The balloon will actually cause, uh, there is a target of around 10 to 15% of weight loss in over around 16 weeks. But this program, what we have is a 6-month program where we have a dietitian along with us who will take care of your diet, who we have a physician who will take care of your sugar levels, your blood pressure, and we'll see to it that they are monitored at a regular basis. We have a radiologist where we require, uh, which we require basically during the procedure, and we also have a means I'm the gastroenterologist who will be taking care of the procedure. And in case anything goes wrong, which most likely it doesn't, as it is a very safe procedure, we will we can always remove the balloon endoscopically in case it is required. Who Now, how safe it is? It is very safe. It doesn't require any endoscopy, any cut in the body. Just swallow the pill. Is it very easy to swallow? Yes, it is quite easy to swallow the pill. It doesn't cause any pain. The only thing which we do is after the pill is swallowed, we confirm the position of the pill in the by doing an X-ray, and then if it is there in position, we inflate the balloon. Mm, does the patient require any dietary restrictions? See, this is in this we have not decreased the capacity of your stomach. Sorry, we've not cut the stomach so that still the stomach is of the same size. So the patient will absolutely require a lot of dietary restrictions. Need to have put efforts from the patient side as well, because if you don't put efforts from your side and keep eating high fat food, then the weight loss will be very small and it won't be justified to take this. So the patient has to be highly motivated when we are planning to do this procedure. Do we require an endoscopy even while removal of the balloon? No, that's the speciality of the Allurion balloon. There have been balloons in the market where we require endoscopy at least to remove the balloon, but in this we usually don't require an endoscopy, and it deflates on its own inside the system and will pass out through the motions.
Okay. Good morning, sir. How much is the nausea that can be caused by this? And will the weight come back after the balloon deflates?
Okay, how much nausea? See, uh, because this is occupying the stomach, there will be initially quite a bit of nausea which will be there. At times, you may even have cramping and vomiting as well. In order to prevent this, we usually give antiemetics and prokinetics to the patient so that they don't have any symptoms of nausea and vomiting post the procedure. Now, gaining weight back, see, as I told you, this is more of a motivational thing as well. So, you have to be very highly motivated. The balloon, when the balloon is inside, it reduces your uh, it reduces your food intake, because of which the amount of food which you eat is significantly reduced. But once the balloon is out, again that space is open. So it is very much important that you still continue the dietary restrictions what have been told to you during the balloon, which have to be followed even after the balloon is removed.
Sir, is this helpful to stop cravings? And how much time does this balloon take to deflate?
It will absolutely help in decreasing the cravings because it affects the satiety of the patient. Cravings will come down significantly. Patient's sugar levels come down. The urge to eat will come down because even a small quantity of food, you will be absolutely full. And sorry, what was the second question?
How much time will this balloon take to deflate?
Take to deflate.
Yeah.
It takes around 16 weeks. After 16 weeks, only the balloon will get deflated on its own.
Sir, can I exercise with the balloon, and if I can, will I feel it?
See, the balloon is heavy because we will be almost installing around 550 ml of fluid inside the balloon. It becomes heavy, but with time, the body gets accustomed to that weight of the balloon. So it doesn't affect you will start getting used to it, and you can always do your daily routine exercises and stuff. In fact, some balloon, it is only a problem in the initial few days. After a couple of days, the patient becomes absolutely accustomed and can always continue doing the exercises.
Doctor, what happens after the balloon is passed?
After the balloon is passed, we usually have our healthcare team which will support you so that you don't gain the weight back. And one study shows that there is 95% of the average weight loss was sustained even at 1 year follow-up. That is because your satiety is better, you get full with small quantities. You will need to continue your lifestyle modifications which were given initially. So the guidance with the dietitian and your physician will be of very prime importance even after the balloon is deflated and removed.
Sir, how long does it take for me to resume my normal activities after placement?
See, the balloon placement usually takes around 15 minutes only, 15 to 20 minutes. Most of the people can return to the normal activity in a day or two. They have a bit of nausea and vomiting, but which would be controlled with the medicines which we usually give. But it would always be a good idea to book a few days off in the initial few days, and then you can start to return to work in around a week's time.
Sir, is there any side effects of having this balloon?
Side effects of the balloon very less likely, but because of the balloon being placed inside, patients may have a little bit of nausea, a little bit of vomiting. In most of the cases, they are usually very well controlled with the medications we give. Coming to the complications, yes, there are a bit of complications, but the complications are usually managed at the same time of the procedure. But after the procedure, we don't have any complications. So it's a safe method with very minimal side effects.
Is it helpful in some conditions like PCOD and PCOS?
See, in PCOD and PCOS, the main thing is about the weight. Most of the patients who have PCOD and PCOS are obese. They have irregular menses. In them, in patients with PCOD and PCOS, to regularize the menses, they need the main target has to be weight loss. If they are able to lose weight, the patients will absolutely benefit from the problems of PCOD and PCOS. So, in patients who have PCOD and PCOS, if your target is weight loss, it absolutely helps in treatment of PCOD and PCOS.
Will I gain weight after undergoing the program?
Again, that is the thing. You have to have a good dietitian with you, and you should be very much motivated even after the program so that you don't gain weight at a later point of time.
Are there any contradictions for this program?
See, usually we don't do it for patients who have heart disease, just so that it doesn't cause any pressure on the heart. But that is also patients who have severe cardiomyopathies, not for patients who have heart disease, ischemic heart disease. For them, I don't think so. It's a problem. Uh, and for patients who actually have high target weight loss, we try to avoid that.
What kind of food should I avoid
Avoid during the
during this
Okay.
course?
See, there are specific dietary recommendations before the placement and during the placement of the balloon. For the weeks before, we try to see to it that the patient is more on a liquid diet so that while we are placing the balloon can be easily placed and there is no food which causes any problem while placing the balloon. And following which the dietitian will give you a good diet chart which will help in seeing to it that we meet our targets and help in weight loss.
Sir, if I'm undergoing treatment for any GI problem, can I undergo this program?
uh, it depends on what GI problem you are facing. If your target is weight loss, this should not be a problem at all.
So, what happens on placement day?
See, on the day of placement, the patient has to come to our center, empty stomach. It usually takes around 15 to 20 minutes for the whole procedure to take complete. We do this procedure basically in a place where we have X-ray, which is easily can be taken, or we do it in a fluoroscopy setup. Once the patient has been asked to swallow the capsule, which has a tube in the end. Once we see that the capsule has reached the stomach, we pull the, uh, we check the position using a X-ray or the fluoroscope. Following which we push around 550 ml of the solution into the balloon, and then the X-ray is again taken after checking the position to check the position of the balloon. So there are basically two X-rays involved. First, after the capsule has reached the stomach, and second is after the inflation of balloon. Following which we remove the um, wire which is connected to the balloon so that the balloon can be placed inside. This usually takes around 15 minutes totally.
Sir, is this difficult to swallow?
Uh, it's almost like a bigger capsule which we swallow. We give water to be swallowed along with the capsule, so the capsule can easily go inside the stomach.
Is this more effective than gastric bypass procedures?
Uh, See, that's the thing. There are two. They both are two different programs altogether. The gastric bypass procedures have more target weight loss. They have surgery involved. This is more of a. You can just lose around 10 to 15 kgs of weight without any surgery. Followed by you can always have a targeted weight loss. This is more of motivation where you will always have to do it the natural way. It's more in the natural way rather than a surgery which is there.
Sir, will this program work for people with high BMI?
This program is for patients with high BMI.
So, what does this program entail?
Intake means
Uh, what does this what do I need to do to be a part of this program?
okay. In order to be a part of the program, you'll have to contact our team over here. We'll always make a consultation with our dietitian, with our endocrinologist, with our physician, see your fitness, how fit you are for the procedure. And usually we do it very means we'll have to get your blood pressure and stuff under control if they are quite high, and then we can easily plan it out.
How much weight can I lose if I join this program?
See, a target weight loss is around 10 to 15% of your total body weight over around 16 weeks time.
Okay, thank you, sir. While ending, I thank doctor for this wonderful session.
Thank you.